First of all, I'd like to start with welcoming everybody to our Positive Pyjama Chats for August. I'm Sarah, and over the last few months, we've all been getting together and chatting about ideas and strategies and things to do at home to stay sane, happy, and healthy. Today, I'm interviewing osteopath, my personal osteopath. She's my health inspiration, my partner in crime here in the clinic, Dr. Alexis Weidland.
Hi all.
Alexis and I have been working together on and off for nearly 2 decades, nearly 20 years. She and I have done life together because she's not only my osteopath, but she's my sister. So she's a big part of my clinic, my life, and as I said, my health inspiration. So we're looking today at interviewing Alexis about the shoulder. Alexis is focused not only on the shoulder as an osteopath, but also on the whole body, how it interacts all together, as well as the mind and soul and how that comes to connect for all of us. What I'd like to do right now is welcome Alexis.
Thank you.
We're going to be talking about all things shoulder today, so thank you for taking time to join us here at Pyjama Chat. Fantastic. So welcome everybody, and thank you for joining us. So Alexis, can I ask you to describe for us the shoulder joints and help us understand why it's so common to get pain in the shoulder?
Okay, so the shoulder is a broad area. It's where the arm meets the shoulder blade, which is at the back, and it's how the shoulder blade attaches to the thorax or the body, which is a pseudo joint. So this is where you've got the shoulder blade, and then you've got the shoulder blade here, and then in your front we've got the whole rib cage. But between we've got muscle and space. So the shoulder, that's not a correct joint in itself, but that position is what allows the shoulder to be able to be moving in the correct way or not. So all of that is interacting. So then we've got the shoulder itself, which is the glenoid fossa of the shoulder blade and the humerus of the arm. And then we've also got the acromioclavicular joint, which is the top part of the shoulder blade and part of the clavicle. So forward again. So the clavicle here, which is our collarbone.
What I'd like to do is give everybody a option to actually see what Alexis is talking about from a
picture.
Anatomical. Yeah.
So then we've also got where the clavicle or collarbone connects in to the front of our sternum, our breastbone, and this is the only location that our whole shoulder complex is actually attached to the body structure. So if you can see, that's actually a really small joint, and that's the only bony joint that's connecting the two things. So that means that there has to be a whole lot of ligaments and especially muscles that keep the whole shoulder stable and working functionally properly. Sorry.
It's all right.
So you can see here on the green part of so you've got the ball part of the humerus, and then you've got the socket of the glenoid fossa, and that's actually quite a wide position. It's a lot like this, whereas the hip is much more like that. So that means that we've got lots more mobility able to happen, that the ball can roll quite widely, allowing us to have a huge full range of movement. But that comes with needing more ligament stability and more muscles around to keep it in the right position and strong. So that means that we need the whole complex to be working correctly, and if any one thing is not happy, then you're going to get a problem, and then over time you're going to get pain. So that's kind of why you can often have pain. So the complexity and the large number of those supporting structures means that there are so many different areas that could get injured and be the actual cause of pain. And then we have this tendency in our lives to have everything forward. So we're facing forward and our arms are coming forward, and we're chopping and we're eating and we're at the computer and we're hugging. Everything that we do is pretty much forward. So unless we're actually doing exercises to come backwards, it's all forwards. That combined with our stress levels and So when we get stressed, we don't breathe properly. And when we get stressed, we hunch forward. We basically have our shoulders as our beautiful earrings, which isn't particularly helpful. So when you're doing that, you can't breathe properly. You also don't have your shoulders in the right position. So you can kind of see that as you hunch forward, you get the clavicle comes forward, the shoulder blade splays outwards and upwards and forwards, and the whole, so you've got the glenoid and the humerus, and that gets rolled this way. And so then you don't have as much space. And then you can see in that beautiful picture, you've got the clavicle on top, and then you've got the scapula sitting underneath. And in that space in between, that's where you've got muscles, nerves, and blood vessels. And when we're pulling up like this, you're reducing that space, which means there's less space for the nerves, less space for the circulation, and that muscle in particular gets squished and sort of grinding against the bony edge. So it can become torn from that, or it can just have repeated injury as it gets slid across and gets upset, and then it gets inflamed. And with that inflammation, you get an even smaller space. So then you have more chance of the nerve being irritated and causing pain potentially down the arm, and reducing circulation so that you are more likely to have tingling down the arm from the reduced circulation to the nerve. And you could have maybe cold or poor circulation in the hand because of that reduced circulation.
So it has a compounding effect by the sounds of things.
Yes.
Amazing. And so tell me, Alexis, sometimes as a practitioner, it's really hard to actually treat the shoulder. Why is that, and why does it take so long sometimes for the shoulder to actually heal?
So when we're treating the shoulder, it's nice to know which tissue is actually injured. So we can do a whole heap of special tests to work out which ranges of movement are specifically affected and where the pain is, to work out which structures are actually being involved.
Right.
But regardless of which tissue is affected, unless it's actually a direct trauma event that has caused that irritation, it's always going to involve the positioning of the whole shoulder complex. And that will include the position of your neck, because as we come forward, that brings everything up, it tightens other things, and it increases the likelihood of your shoulder coming forward. And it definitely is associated with the way our whole rib cage is working, whether you've got a rib sitting out, or whether through stress and holding your breath for so long, that causes a whole tightness in your general rib cage, and your ribs don't actually move as much. And they're often, so you can also have things like scoliosis or an increased kyphosis, which is this forward movement of the spine, or you can have a small vertebral, so you've got two vertebrae, you can have a dysfunction between those two vertebrae so that one is twisting off and rotating. And when you do that, that pushes, so you've got one vertebra and you've got the rib attaching. So when this twists, you get the rib coming back as well. So then you've got the rib pushing out, and so you don't have this flat surface for the shoulder blade to be sitting on anymore. So if we don't treat all of those factors, then we can't increase the mobility, the circulation, and the comfort of the whole area to be able to work properly again. So we can treat that one tissue that's affected, but it won't have all of the factors it needs to heal properly, and it will keep getting irritated because now that whole posture is off, and so it's not working correctly anymore.
So I'm hearing that there are a lot of different elements to what is going on in the shoulder structure, and it's not necessarily just the shoulder itself, but other parts that can actually influence how the shoulder is sitting and where the pain is coming from.
Yeah.
So as a therapist, unless we take time to treat and look at all of those different aspects, it can be a limited result that we get.
Yeah, and so because our posture and because our stress levels are such a huge part of that, we need to work with our clients to support them to have relaxation techniques and just breath work to help us to come back into the body and reposition and take our earrings off. And we need to have some posture and lifestyle changes to support that better positioning, because if we're like this is forward, it can't work properly, and we're going to slow the healing process. But if we can consistently throughout the day come back to this position, then we're widening and supporting the whole area to have a chance to heal and the position to be improved.
Awesome. Guys, if you have any questions, I can't see the chat today, so if you can write them down and we can address them at the end, that would be fantastic, because I want to make sure that as many questions today are answered as we possibly can. Alexis, if I can go on to question 3. As a massage therapist, sometimes there are times where the client isn't getting the result that I would like them to get. Mm-hmm. When is it that, how do I know when is a good time to actually refer the client to somebody?
Okay. So that's a great question. When your client comes in, if there is a trauma event, so they've fallen on their shoulder and they're in substantial pain, or they had a car accident and they're in substantial pain, or if you have any reason to suspect a broken bone or something like that, you're obviously going to want to refer off and get the doctor to provide imaging or something like that. And potentially they'll need an ultrasound or some other deeper imaging to try and work out which softer tissues are affected. If you feel like it's a more chronic issue, then you can start with the things that you already know. If they're not responding the way you would expect, then it's always a good idea to get a second opinion from another practitioner that you trust. So be some kind of osteopath, chiropractor, physio. It depends on the situation and the people that you know, but someone that you trust. If they have any red flags, so the pain is constant and it doesn't change with any change of position, that suggests that there's something else going on, and you probably do want to get them to get some imaging happening. So that's probably via the GP or via an osteopath, etc., and then the GP. And then it all comes back to your experience level and your comfort level. So you might have the experience but not quite the comfort. You don't feel confident enough. And while you can probably provide a lot more than you think you can, it's still worth referring off and getting the extra support, and then you can work together.
So creating a relationship with another practitioner.
Absolutely.
That both can help the client to ultimately help the client to have the best result possible.
Right. So if for example, the two of us were working together, you can focus on the broad spectrum of the whole muscles, and you'll be working with the whole back and the neck and the whole shoulder, and at the front as well into the chest. And then I can, because I know you're doing that, I don't have to focus on those areas. So I can focus deeper into the specific joints or the specific tissue that's affected, or working some of the specific ribs that are in trouble, or that sort of thing.
So you can get really into the nitty-gritty of exactly what's going on, because the larger, broader things are actually being taken care of.
Right.
Great. So that sounds like an inspiring way of looking at practitioners working together. Mm-hmm. Certainly sometimes I've had other massage therapists tell me they're really scared to refer clients and they don't know which other practitioners they can trust. How would you address a concern like that?
Okay, well, two perspectives there. One would be the circle of practitioners that you know, and the other would be your job and your aim for that client. So we need to remember that the client has come in for help from you, and they don't necessarily have a clue what's going on for them, or what modality or modalities are actually required to fix what's going on. So it's up to you to help them to understand. So you can, if you're able to explain to them that you can do this, but they actually need that as well, and help them to find the right practitioner, then they're going to feel much more supported and much more cared for and much more respect for you, because you know your limitations and you know that, yes, you can help them, but only this much, and that you're going to actually help them find the rest of the answer, instead of just leaving you in limbo and saying, well, I can help here, but you'll have to fend for yourself for the rest. You know, you can get a partial result here. They're going to trust you a whole lot more, and they're much more willing to see you as their trusted advisor. So they'll call next time that anything goes wrong and they'll ask your opinion. And they're also more likely to refer. So you might lose a couple of treatments here or there, but you're going to gain a trusted client who's going to refer all over the place, and you'll end up being much more busy. So it can really leverage your impact in helping people in general, rather than limiting it. You get a better result. Yeah, you get a better result for that client, and you get much more ability to help heaps of other people. So then the next bit is having a group of practitioners that you trust, that you would be willing to actually refer to. So really that's about finding networks, or like this sort of situation, you get a chance to interact with some other people and see if they're your kind of people, if you have similar views or not. Or when you're going to your AMT or similar meetings, you've met other people and they might have practitioners that they refer to, so that you can connect with them and have conversations and just see if that's somebody who you feel that you can trust. Once you do that, then you've got a bit more of a relationship you can actually leverage, and you can refer your client to that person, and you can speak to that person yourself, so that you can work together for that client, and so that you can learn a bit more of, how they treat and how they can specifically help your client, so that you know better next time when you should refer to that person.
Awesome.
And then that person's always going to be appreciative of you sending people to them, and they're much more likely to be able to refer back when there's somebody that they see that you can help as well.
Thank you. So we've covered a lot, Alexis, and you've talked us through some of the anatomy of the shoulder as a whole, and how posture affects pain and the conditions of the shoulder, and why the shoulder can be such a complex condition. It can be really tricky to treat, especially to actually really get the result that we're looking for. I know you're also working on some videos around those ideas as well, but can we bring this back to what Pyjama Chats is all about, and some simple steps for what we can actually do at home now, so that people can get healthier and actually get more mobility in their shoulders themselves?
Absolutely. So we can work through 3 simple techniques that are going to improve our posture and reduce the pressure on those sensitive tissues. And that will help us to relieve any pain that we've got, and it will help us to be able to start to strengthen it and stabilize that whole shoulder area. So the first one is a very simple yoga technique. So we're going to be putting our arms behind our backs and interlocking, and you want to be focusing always on the whole shoulder blade area, and we're generally pulling down and in and together using these muscles here. You can see that, great. Not your upper muscles. So then all you're doing is a 2-step process. The first one is bending forward and bringing your arms up. And as you bring your arms up, you're aiming to bring your arms as high as possible, but always bringing your shoulder blades together. So you're not bringing your shoulders up, you're always bringing them down and together. I hope that's clear. The next step is to then, so the aim there is to be in good posture first, and again you're bringing your shoulder blades down and together, and just your arms are basically otherwise just hanging, and then you're just bringing your head down, and as you do that you can gently pull your shoulder blades down and together a bit further, and you just drop back into that, which is extending through the whole chest. Brilliant. So the aim there is we're extending through the whole front part of our body. So you're getting into the rib cage and into the chest and into the neck, and we're bringing it back into the position that we don't usually use. So I'll just go through that again. First of all, we're coming forward and bringing up. And then we're coming back and dropping back. So then the next technique is more of a relaxation technique, and again it's to get more extension through the whole rib cage, chest, and into the front of the shoulder. So this one is a great thing to do in the evening, because we're lying on our back in a semi-supine position, which is a brilliant approach for helping our intervertebral discs to rehydrate. So at the end of each day, after gravity has done its thing and we've not drunk enough water and all sorts of things, and we're getting gradually smaller, then we're lying back down and our discs can reabsorb the water and expand and get a bit longer again. That puts less pressure on the spine. So it's great for the whole back in general. And then we're working specifically into getting more extension into the ribs. So we're lying on our back. You're putting your knees up and your feet flat on the floor, so that's a semi-supine. We're aiming to do it on the floor because that's nice and hard. Then we're rolling up a nice towel, which is squishy, and we're going, so I've got the towel in thirds for the length, and then it's rolled up, and then we position that directly under the spine, and then just put one arm out. So then you're bringing the arm up and straight out. Okay? So that's to get that extension out, and so you're just dropping your arm as far back as you can onto the floor. And you're staying there for, thank you, Sarah, sit up again. Then we're staying there for up to 10 minutes, but the aim is only if we're comfortable. So if there's any pain, we want to stop. That one, you're staying for up to 10 minutes as long as it's comfortable. And if it's not comfortable, you just want to carefully get out of that. And then the next one is more about reactivating the shoulder stabilizing muscles. And okay, brilliant. So we're reactivating the shoulder stabilizing muscles, and we're getting some strength happening again. So the aim here is we're against a wall, where legs hip width apart and arm length away from the wall, and the arms are straight at shoulder height. Then we're focusing down on the shoulder blade again, and we're gently pulling down and in and together, and we're using these muscles. Yeah? So we're not using these ones at all. So Sarah, if you can do the movement using these muscles and relax, and then do it using these muscles. So this is a much more subtle technique, and this is interacting with the whole sits muscles, the stabilizing muscles of the shoulder. These are the ones that we need to be moving and functioning correctly in order for the shoulder to sit correctly. Then from that position, so this is a 3-phase process. The first one is just doing that. So if you have a client without much activation of these correct muscles, the best thing to do is just do this 3 times. So you do that, and then you relax again, and then you reactivate. And you're just holding for a few seconds each time, and you do it 3 times, and you do it a few times a day. That's just to reactivate the muscles, so the brain to know where the muscles are, and the muscles do what they need to do. And then the next step is you come back into that, you do that same activation, and then you do a push-up against the wall, Sarah. Making sure that you keep those shoulders active the whole way through, and then you stop and you notice, it's all right, come back. Yeah. Once you come back, then you stop and you notice where your shoulders are to see if they have actually come out again or if they're staying where you wanted them. And when they're staying where you want them, then you're doing the 3-step. The third process is actually doing 10 push-ups against the wall, keeping that stable motion, which is starting to build a little bit of strength. And then when you can do that comfortably and it's continuing correctly, you can continue, if you would like, to do push-ups against the floor, like a full a women's push-up or a full push-up against the floor, but always making sure you're activating this first, and then you're only going down as far as you can comfortably do with good form, and you're only doing it up to 10 times, but only as many times as you feel that you can keep all of this activating properly and good form, so your back's straight and your neck's not getting irritated and all those sorts of things. So that's the 3 techniques. I'm hoping they all made sense.
Excellent. Thank you. Great. So we've got some things to work on at home.
I hope so.
So that we can actually stay happy and healthy and look after our shoulders ourselves, as well as with the help of other therapists. What I'm going to do now, everyone, is invite everybody to join in the chat. So you're very welcome to turn on your mics. We've only got about 5 or 6 minutes left of our time this morning. But does anybody have a question for Alexis? Julie, is that you raising your hand?
Hi, yeah, I think a few people have got questions in the chat. Thank you, it's very informative. Alexis and Sarah, good demonstration. Just the, when you put your hands behind your back and then you lean backwards, I imagine when I get tight here, I can't even do that, let alone drop everything backwards. It would be quite restrictive, I think.
Sure.
So I guess if you don't do it.
Yes. So then your first step will be focusing on that movement. So with good posture first, then you can do the forwards and backwards. pushing into the back bit to make sure you're starting to get movement happening there. And then once you're getting that happening, then you can just gently drop back as far as you're comfortable. Mum, Von, would you like to discuss a little bit further about that? Because it depends. What I just said is acceptable. However, there are other
parameters that are...
Yeah, so Von, if you'd like to just bring that bit.
Julie, for your information, Von is a yoga teacher. That's why Alexis is called her.
Yeah, mine's not too bad at the moment, but I had a C6 compression that literally I got to a point where I couldn't even hang my shoulder forward. I couldn't lift it. It was really bizarre. Like, I had random stuff. This was like excruciating, and I had to go drive somewhere and couldn't even drive, basically. Had to get an Uber to the physio. But somehow he released it and did, I don't know. But it was very weird, and it was C6 compression. But yeah, I do a bit of this, like the...
Yeah, so with the C6 compression, I would agree you probably don't want to go too much backwards because you're wanting to aim to get more distraction. So I would focus on doing the lying on the floor, get more space.
The opening is great, and scapular activation. So I do Pilates once a week, so I do know about that. It's just having the discipline to do it. And if you're doing push-ups on the floor, aren't you using your pecs as well then with gravity?
You're using the pecs on the wall as well. You always go, basically, if you're doing a push-up, it uses the whole shoulder complex, which includes the pecs. So that in itself isn't a problem. You're also using back muscles, the lats, everything. So that's one reason we start at standing up, is because we're focusing much more on the stabilizing muscles, and you can isolate them more effectively. It's also less gravity, so it's easier. And then when you're going to the floor, as long as you're using good posture and you've got those muscles activating properly, you won't have a problem. Does that make sense? So you don't have to go all the way to the floor either.
The stabilizing muscles in a picture, I guess we can see the pictures you already posted, but it might be nice
so we
to
can
see
go
them
back to those pictures. Send them to you as well.
Thank you.
Happy to send them to you. That's not a problem. I will just screen share. Okay. That's a good question.
The lats, trapezius, sort of mid.
I don't know whether you want this one or...
We'll start there. That's okay. So that's showing the supraspinatus at the top and the subscap, the infraspinatus, and then you've got a bit of teres there. And then at the front of the scapula, you've got the subscap, so that's between the scapula and the whole rib cage.
And it's also lower traps too, isn't it, doing the pull down?
Yeah, you've also got serratus anterior, which is the shoulder, which is connecting into the shoulder and through the ribs. Which other direction?
Lats, maybe the latimus
Had
dorsi.
another picture. Lat dorsi, yeah.
That one. Yeah. So that's basically the same stuff. So these are just the deeper level ones, and then there's a whole lot on top of that. So when you're doing a shoulder push-up, that really uses every single muscle in pretty much our whole upper body. So, these are the ones we'll focus on. Sorry?
Yeah, thank you. I'll ask one quick question, then let everyone else talk. I have this weird thing. I do Pilates with a physio, and I keep telling them basically every time I have my arms above my head, whether it's lying flat or upright, I literally get tingling in my fingers.
Right.
It's all the brachial plexus and cervical still probably, isn't it, in posture?
Yes. So that's going to be more to do with a minor impingement situation going on in the shoulder. So that space between the clavicle and the shoulder blade is getting reduced, and that gets reduced as you bring your arms up. So when your arms are coming up, you're getting a direct reduction of circulation into the nerves, and that's what's causing the tingling. So that would require probably some cervical stuff and getting into reducing the first rib, because it could be the first rib that's the problem. So the first rib sits up higher, and that helps to reduce that space as well. And then you would be focusing on that whole postural situation so that you're getting the shoulder blade down and away from the clavicle so that there's more space for all of that. Does that make sense?
Do you think it's possible to stop that happening altogether? Because it's just been it's always been there for as long as I can remember, but it's not major, so you just put your arms down again and start.
Yeah.
But you should be able to get rid of it.